talking about our thyroid gland. The thyroid is located on the neck, and it is a shield-like structure. It looks like a shield, really. And it secretes thyroxine, which we all need for our metabolism. The average weight is about 25 grams, but for some individual, it can be the size can increase, either because of a benign lesion, meaning it's not cancer, or because there is a tumor growing in there. And when this happens, it distorts the production of the thyroxine from the thyroid gland. So we can have hypoproduction, which we call hypothyroidism, or hyperproduction, which we call hyperthyroidism, and they all have various symptoms that it gives. Commonly, for people that have hyperthyroidism, meaning that the quantity of the thyroxine in the blood is more than the body it needs. Some of them may have their hypotoning heart, which we call exophthalmos. Some, their hearts may be racing like a horse, which is called palpitation. Some will sweat a lot, and some people will say this place is hot when everybody is saying this place is cold. All right. And for the female folks, their menstrual cycle can be distorted, either excessive or a reduction. But for hypothyroidism, the individual may just see that it's getting fatter, is fatigued, he cannot maintain properly. Such individuals, even if you ask them what is 2 plus 2, you just see that they are slow in response. So there's a reduced metabolism in there. And then those ones, their thyroid will actually be very big. So these are the benign causes, and all can be treated. However, when we sight the neck of an individual and the neck is swollen, we often tell them, please, can you swallow your saliva? And once they swallow and there's a movement of this thyroid gland, say, oh, this person has a big thyroid. So what should the person do? For some people, there is no problem. But how will you know that there is no problem? It means that thyroid gland needs to be evaluated. An ultrasound of the neck needs to be done to know the state of that thyroid. Are there nodules in it? Are there excessive blood supply to the thyroid gland? Also, there is a need to stick in a needle, which we call fine needle aspiration for cytology. What type of cell is this that is inside this thyroid gland? And the result can either come out as it is benign, meaning it is a normal cell, only that is big, or is suspicious of malignancy, or it is malignancy. When it is malignant, meaning that there is cancer in it, then what type of malignancy are we talking about? So for those ones, it depends on the type. Like for some people, they may need to do radio iodine. For some, the thyroid gland just needs to come out, and then so that the body can be fine. However, when you remove all the thyroid gland, then it is needed that you should supplement what the thyroid gland normally produces. And that is the problem we have when we get to talk with our clients. So I need to use medication for the rest of my life. I can't do that. But if you have to use a tiny tablet for the rest of your life and the whole body is fine, I think it's advisable. So surgery most of the time is needed. But for some people, if it is the type that radio iodine can solve, then they could schedule them for radio iodine, and then that could be enough. But for most people, for cosmetic reason, you can remove your thyroid gland. When it is cancerous, you can remove your thyroid gland. However, I must not fail to say this, that some people actually carry so big a thyroid gland that it compresses their trachea. What is trachea? The windpipe where we breathe from. Once this happens and there is compression of the trachea, honestly, the most sensible thing to do is to relieve that compression by removing the thyroid gland. Oh, you are saying remove the thyroid gland. Is there complication? Of course, there can be complication, but there is always a way around the complications that can occur after thyroidectomy. For some people, they might need, like I said, if it is all the gland that is removed, then you have to supplement with a level thyroxine every day so that the metabolism can continue. I wish I have been able to educate you on the thyroid gland. So when next you are going for your checkup, ask your doctor that you like to do an ultrasound of the neck and also a thyroid function test to check the level of your thyroid. So when next you are doing your comprehensive checkup, in which Dutchess International Hospital is one of your best shots, we will be glad to have you, where your thyroid gland will be evaluated. If it is normal, there will be no need for ultrasound, but we always want to check the thyroid function, which is a form of blood test. And I tell you, you will enjoy your stay with us. Thank you for your time.